Hi, my name is Emily Brown. I'm doing my presentation on mental disorders and crime, and I'm going to talk about the prisons and how it affects those who have mental disorders. In America, there are approximately 42.5 million American adults that are diagnosed with some form of mental disorder. Only 62.9% of those adults with serious illnesses receive treatment within the year that their illness was reported. The National Institute of Corrections shows that there is an increasing number of people in jails and that 16% of the 10 million incarcerated are mentally ill. Some of these mental illnesses include schizophrenia, depression, bipolar disorder, and anxiety. Inmates ages 25 and older have the highest rates of mental illness. Those who are 55 and older have some of the lowest rates of mental illness. Because of the lack of treatment and lack of support for many of those who suffer with mental illness, these adults act out, violate the law, and become homeless. Homelessness and unemployment for those who have mental disorders can lead to crimes such as robbery, homicide, and illegal drug use. Almost half of the charges are from drug trafficking-related crimes. Unfortunately, mentally ill adults are sent to prisons multiple times because of the lack of rehab and treatment after their first time in prison. 49% of the time, inmates with mental health problems are convicted of a violent offense. Some of that is including the use of weapons. Mental hospital beds in prisons have been dramatically reduced since 1850. And because of the extreme low numbers of facilities in the U.S., these people are being sent to prisons when they commit crimes instead of rehab facilities or mentally ill hospitals. People with mental disorders get sent to normal prisons, which leads to the overpopulation and overcrowding. Approximately 50% of prisons' population includes those with mental disorders. Prisoners who are diagnosed as mentally ill are typically sent to solitary confinement because of the overpopulation and overcrowding and limited resources. Many prisoners end up taking a longer sentence and are punished more because of the lack of treatment. Those who are mentally ill in prisons cost up to 3 times more than other inmates. Per day, those who are mentally ill cost up to $170 per day, and those who are mentally healthy cost only $90 per day. A lot of the funding for mentally ill inmates just gets sent throughout the prisons. It's not directed towards treatments and housings of those who are mentally ill. These are some of my suggestions to fix the problem of the mentally ill in prison systems. Opening up more mental hospitals would be a solution to this problem, but I know that there are many reasons why mental hospitals have been shut down over time. Prisoners who have mental disorders need to be separated from those who are mentally healthy in prison atmospheres. However, they should not be put in solitary confinement because that would just worsen their symptoms. Early treatment for adults can help reduce the number of the mentally ill that do not receive treatments. The assisted outpatient commitment is something that allows involuntary treatment of individuals who suffer from mental disorders. This allows prisoners to be a part of this assistance, and it can help lower the overcrowding in prisons and give the patients the treatment and rehab that they need. This might be some feedback that critics would say about my solutions to the problem. Since there are very few mental institutes in the United States, some might ask where the inmates who suffer from mental disorders would go. Housing and rehab facilities seem like rewards for people who have mental disorders that commit crimes instead of punishments for criminals with mental disorders. We need to find ways to punish those who commit crimes, but in a safe and treatment kind of way. There are many different types of mental disorders, but schizophrenia, depression, PTSD, and anxiety are often overlooked. Many people who have social disorders are not diagnosed properly. and they may not realize that they have a disorder, so that might lead to more crimes committed with those that have the mental disorder. Awareness for these disorders may help, and it can lead to early diagnosis, which can ultimately lead to less mentally ill inmates. There are many different types of mental disorders, and they are not always harmful, but with the assistance of drug abuse and weapons, people with mental disorders can be dangerous.